Good morning. My name is Dr. Little. I'm one of the dentists here at the Turning Points. I've been here since inception. Our work is absolutely free to our patients and our clients, and we're glad to do that. But even though we don't charge anything, all dental procedures do have an insurance code, and there's a dollar value associated with that. This last month, we did almost $250,000 of free dentistry for the disadvantaged people. When I first started out, I thought I'd be a hero and somebody would have a toothache and I'd pull out a aching tooth and pat myself on the back for doing a good job. But that wasn't the situation at all. We were seeing years and years, 15, 20 years of neglect. Not one bad tooth, but multiple bad teeth, if not all bad teeth. So it became wholesale extractions, and it soon became apparent we couldn't leave people like that. So making dentures, which I have in my hand for a client, making partial dentures became a big part of what we do to restore their ability to chew food, restore their ability to smile, restore their self-worth and self-esteem, their employability, and things of that nature. We see about 25 to 30 patients a day, but still we see about 2 or 3, that's all we can do, walk-in emergencies every day, and we turn away 10 to 15 phone calls a day. So the need is absolutely tremendous. I think if I had 5 dentists working 24 hours a day, we still would be unable to satisfy the need. But one good thing, we're saving the taxpayers a lot of money. Prior to our existence, if a disadvantaged person had a toothache, their only source of treatment was go to the ER. ER cannot treat them over there. All they would do would give them perhaps a few pain pills and some antibiotic pills and tell them to go see their dentist on Monday, which unfortunately they could not do because they didn't have the funds to do it. Dentistry is a very expensive luxury. It's not even though it's a necessity, it's a luxury. But their bill, every time you walk in, you can't walk out of an emergency room. I don't care if it's 2 aspirins in your hand without having a bill of $1,000. And who was paying all these bills? Well, it's the taxpayer of Manatee County were paying these bills. So every patient we can see over here saves the taxpayers thousands and thousands of dollars.
My name is Jill Hinman. I'm the clinical director for Turning Points Medical and Dental Clinic. We serve as primary care providers for the homeless and those at risk of being homeless or the working poor here in Manatee County. These residents are not able to afford medical insurance and don't qualify for Medicaid or Medicare. At this time, the 4th-year medical students from LECOM, Lake Erie College of Osteopathic Medicine, help to deliver care to our patients Monday through Friday, and with the assistance of their supervisor, clinician, and preceptor that is in attendance with them. This gives a unique opportunity to serve this population as well as have hands-on patient care for these 4th-year students. We also have a dermatologist and podiatrist that comes in monthly for a clinic of their own to see our patients. We also are looking forward to having at least 2 to 3 nurse practitioners coming on board to be a part of our clinic as well and to serve our population. In addition, we are having several physicians now calling us to offer primary care services. Volunteer RNs and LPNs also assist us in giving their hours and skill to our patient population. Every day we are reminded of the many needs in this unique patient population. Children's dental services are lacking. The need for more specialized medical care such as gastroenterology for colonoscopies, orthopedics for setting fractures. Additionally, this is a population clientele that have difficulty making ends meet. They certainly have problems paying for medications, also paying for lab services.
Okay, so my name is Alex Vasquez. I am a clinical pharmacist here at the One Stop Clinic. And I kind of have a unique role for a pharmacist. I do chronic disease management for the clinic here. Our clinic is mostly homeless patients, all low income, uninsured patients in Manatee County. And a big focus of our clinic in terms of goals is to help our patients manage their chronic diseases. This is important for a number of reasons. Probably the main reason is that the better controlled their chronic diseases are, the less sick they are overall, which means the less likely they are to end up in the emergency room or on with a 911 call, something like that, for high blood sugar, for a heart attack, for something like that. So the more we can help the patients control their chronic diseases, hopefully the less burden the patient will have with hospital costs, and ultimately the less the county will have with hospital costs, because a lot of these patients, because they're uninsured, are not going to be able to ever pay these hospital bills.